Welcome to the CETEC podcast, your go-to source for everything environmental engineering. Join us as we delve into sustainable industrial practices, exploring topics like wastewater treatment, water purification, solid waste management, air quality control, noise and vibration, environmental impact assessments, and the latest in environmental legislation. Whether you're a seasoned professional, an industry leader, a student, or simply someone eager to make a positive impact, you're in the right place. Together, let's pave the way to a sustainable future, one episode at a time.
Hello everyone, welcome you all back for another episode of our video series. Today we are going to discuss about the air quality index for Sri Lanka. As you all know, when we check the air quality using our mobile phone app, they show a value for air quality. That value is called as air quality index. Today we will deep dive into how this air quality index is calculated and what does it mean. And we have a specific guideline for Sri Lanka to how to calculate this air quality index. As we all know, the air quality is determined by the pollutant level in the air. So when determining the air quality, the consideration is given to the most commonly found pollutants that has significant impact. Knowing that the air quality is a key to taking necessary actions and precautions against health issues caused by this poor air quality, and of course it will mitigate the harm to wildlife and ecosystems if we know the air quality in advance and if we take the measures. And it also helps making the informed decision on regulation and policies to improve the air quality. When measuring the air pollutant levels, the concentration of the pollution are normally measured in units such as micrograms per meter cube or parts per billion. But these indices shows the amount of pollutant in the air. But as the general public, we are not very much familiar with these measurement units. If we have a single scale, then it would be simplify the understanding of this air pollutant level and their effects. This scale, which is known as air quality index, is developed for that purpose. The air quality index is range from 0 to 500, and this AQI or the air quality index is categorized. Each category is assigned for a specific color to aid the understanding. So in the air quality index, other than the value, we have a color code as well to better understand the health or the impact level. Leveraging this health and environment impact to exposure to the pollutant, distinct breakpoint concentration values and averaging periods are also introduced with this air quality index value. We are calculating index for each criteria pollutant, and it is referred as sub air quality index value, which enables the assessment of each pollutant individually, and the highest sub air quality index value is considered as the air quality index value. Number of different air quality indices are introduced for different countries and regions and frequently influenced by their respective regulation and standard. When enforcing an air quality index, the pollutant composition, social and economic condition should also take into consideration. Air quality index for Sri Lanka is referred as AQI-SL or Air Quality Index Sri Lanka. Takes the inspiration from the AQI published by the United States Environment Protection Agency, we commonly known as US EPA. Breakpoints are largely derived from the National Ambient Air Quality Act of Sri Lanka, and which was based again on the guidelines and interim targets set by the World Health Organization (WHO). And the aim is to establish this comprehensive air quality index that take into the account of international standards as well as the local standards. This Air Quality Index of Sri Lanka is developed by Central Environment Authority Sri Lanka, and it was launched in June 5th of 2023, which is the World Environment Day. And basic objective of this exercise was to simplify the air quality data for the public and policymaker understanding. So, as I mentioned before, there are different color codes also assigned for this air quality index, such as green means index value 0 to 50, which is considered as good, and we have yellow, which is moderate level of concern, value ranging from 51 to 100. Then the orange is there, slightly unhealthy, which is the value is ranging from 101 to 150, and red is unhealthy, 151 to 200, and the purple is very unhealthy, like AQI value from 201 to 300, and the maroon, the highest one, the hazardous one, the 301 to 500. So these are the color codes and the indexes values mentioned in the air quality index criteria in Sri Lanka. So what does this value mean? So 0 to 50 means good. That means ambient air quality is considered to be healthy, or potential risk of health is negligible. And the moderate category, whereas the value is between 51 to 100, the air quality is acceptable. However, the minor pollution level may pose a moderate health concern for the vulnerable sensitive individuals. And the next category, which is slightly unhealthy, index value from 101 to 150, at risk population such as hypersensitive people or people with respiratory diseases may experience health effects, but the general public is unlikely to be affected. And then the next category is considered as unhealthy, the value from 151 to 200. So everyone may begin to experience negative health effects, where the number of sensitive groups may experience more serious health effects. Then the very unhealthy, which is a quality index value from 201 to 300. So that this level trigger a health alert, meaning everyone exposure to this air quality experience severe health effects. And the next one is the hazardous one, 301 to 500, which trigger the health warning in emergency conditions. And entire population is even more likely to be affected by serious health impacts. In order to at this stage, in order to eliminate the adverse health impacts, instantaneous countermeasures has to be deployed, and keep the public aware on the situation with management practices. And if the air quality index is beyond 500, that is the pollution level is too high and out of range, and hazardous even more. Let's look at what is the health message incorporated with these categories. So green, which is good, is now the health message has two categories. One is for the at-risk population and the general population. So at-risk population means the people who are hypersensitive and with the respiratory health issues. When the category is good, the at-risk population can also enjoy the outdoor activities, and for the general population it is ideal air quality for outdoor activities. And when it's come to the moderate, for the at-risk population, the continuous day-to-day activities can be carried out, but with a caution. And but for the general public, they can continue usual activities as usual outdoor activities. And when it's come to slightly unhealthy, where the color code is orange, the at-risk population has to reduce their outdoor activities and avoid this. Basically, they have to avoid the outdoor activities. And for the general publics, they can continue the day-to-day activity, but with a caution. And the unhealthy, where the level is red, the at-risk population has to avoid the outdoor activities and limit the pollutant exposure as well. And for the general public, they have to reduce the outdoor activities and limit the pollutant exposure as well. And when it's come to the purple level, which is very unhealthy, the at-risk population has to completely avoid the outdoor activities and limit the pollutant exposure and get the medical advice as well. For the general public, also they have to avoid the outdoor activities and limit the pollutant exposure. And then when it comes to the hazardous level, at-risk population, they have to fully avoid the outdoor activities and get the medical advices and be alert. And general population, they have to avoid fully the outdoor activities and limit the pollutant exposure, and they may have also have to get the medical opinion or medical advice. So then if the AQI or the air quality index is more than it, then it is considered as very hazardous, and it has to be tackled case by case scenario. Uh, so now, what are the key consideration for this at-risk population? So as we mentioned earlier, the at-risk population means the people or individuals with heart or respiratory conditions, and they are the most vulnerable people to the effect of poor air quality. So there's a outdoor and indoor air quality. There are two air qualities, outdoor and indoor. So outdoor air quality is monitored, and an area near the pollution sources may have the highest risk. So where the roads, industries, where these pollutants are emitted into the atmosphere, they near to those areas has the highest risk. And but in the outdoor, the dense tree cover can reduce the outdoor air pollution. And when it's come to the indoor air quality can be similar to outdoor if the indoors are exposed to the outdoors through open windows and vents. But air filtration systems and air conditioning systems can improve the indoor air quality. So if those we have such systems in place, then the indoor air quality can be much safer than the outdoor air quality. And so what are the protective measures for this at-risk population? Those will be use the respirators such as KN95 mask during the high AQI levels, and minimize the pollutant emitting activities such as smoking and cooking. And also the public awareness is also very important for these at-risk populations. So the media coverage is recommended, and it has to be they have to aware the people regarding this unhealthy or worse AQI levels, and implement of contingency response plans during this critical air quality scenarios has to be in place, so that the contingency response will definitely help these people at risk. So how do we use this air quality index value in day-to-day life? So we can see these AQI values through different platforms such as website apps where we frequently use, and screens, display boards, TV, newspaper, and social media. So the color and category is represent the air quality, such as red is considered as the unhealthy level, and at the same time we can see the numeric value as well of the air quality index, which indicates a position on the air quality index scale. As I described earlier, the AQI is calculated in the dominant pollutant approach. It means the air quality index value reflects the highest sub-index pollutant that doesn't account for the combined effects. So example of these normal measurements we considered for the AQI is PM values, like it can be both PM 2.5 and PM 10, and we are considering the ozone, carbon monoxide, nitrogen dioxide, and sulfur dioxide. So these are the key parameters when we consider for the when we are considering the calculating the AQI. So by using this AQI, the general understanding of this AQI helps individual or the general public to make safe choices. So here we can see the air quality index value, and in this example you can see there's a number of measurements are taken from for PM 2.5, PM 10, O3, CO, NO2, and SO2. And when we consider the sub AQI values, PM 2.5 has the highest sub AQI value, so that the overall index for the AQI would be considered or taken from the PM 2.5 value. So that is the AQI value for this scenario. So different countries and regions have developed their own AQI scheme suit for their local standards. such as the United States, Malaysia, India, UK, and Canada, Australia, and even and also Sri Lanka has their own AQI indexes or schemes, index schemes. And when considering this AQI, there are two things like breakpoints and indexing. So breakpoints are the threshold concentration define the boundaries between these categories, between this yellow, orange, or red category. So they are defining the boundaries, which is called as breakpoints. And indexing means indexing convert this pollutant concentration into similar health effects into single AQI values, which means different concentrations, different pollutants are measured in different concentration or different units, but indexing helps us to consider all these and summarize all these into one AQI value. So as I mentioned earlier, the AQI ranges from 0 to 500, and in Sri Lanka we have divided into 6 categories for simplicity. And this is the break point table which we used for Sri Lanka, and so you can see with the index value how much of each concentrations of the each pollutant is considered when we are calculating the index. So you can see how much values has been considered when we are calculating the breakpoint for each subcategory, and this is the indexing calculation. So for this one also, for each index level or the each AQI level, we have different quantities of each pollutant is listed. As example, let's say for the green level or the most healthy level, the good level, which is the index between 0 to 50, the PM 2.5 value is should be between 0 to 25 micrograms per meter cube, and when it's come to the PM 10, it should be 0 to 50 micrograms per meter cube, and for the O3 it should be parts per billion value, which is between 0 to 50, and CO again 0 to 2250, which is in again ppb value, and NO2 SO2 also in ppb values from 0 to 65 and 0 to 15 respectively. So such like this, we have different indexing values and calculations are listed for each subcategory at the AQI level for each pollutant. So air quality index determination process is based on the each sub air quality index from each pollutant. So for PM 2.5 normally we measure for 24 hours, and PM 10 is measured for 24 hours, and O3 is for 1 hour, and carbon monoxide is for 8 hours, nitrogen dioxide is for 1 hour, and SO2 is again for 24 hours. So these are the main key pollutants, and these are the main measuring times for each pollutant when we are determining this AQI. So after getting these values, we calculate the sub AQI for each of these pollutant, and out of these sub AQIs we choose the maximum pollutant or the maximum value, maximum sub AQI value, and that is considered as the AQI value. When we are determining this AQI, the at least one particulate matter concentration shall be presented to get the AQI. So at least PM 2.5 or PM 10 should be there when we are calculating the AQI, and the AQI value is rounded to the nearest integer when publishing, and so unit conversion is also needed if the measurement units is other than the measurement units specified in the breakpoints. And exposure and time variation. So AQI categories depends on the exposure levels and the time. As example, 24 hours for the most pollutants, and the shortest time is for the 1 hour, such as for ozone. So we can forecast the AQI as well. there are predicting tools or the modeling tools to predict the future air quality variation. So here we have compared the AQI between United States, India, Canada, China, and Sri Lanka. So each countries has different ranges for their the subcategories, but the color codes is same for every index. That is green, yellow, orange, red, purple, and maroon. And but the range for each category is different from country to country. So, what are the application of this AQI in Sri Lanka? Basically, we can use in day-to-day life and planning these outdoor activities and protecting vulnerable people in our communities, and it can be used for our decision making as well. And the health message from this AQI would be avoid the outdoor activities when it is come to when very unhealthy conditions. And when what are the challenges and opportunities of this AQI? Challenges would be the data availability and completeness because of the lack of sensors and maybe the technology. And the other challenge would be public awareness and the interpretation, so that we are trying to give you the knowledge how to interpret the AQI values and what does it means. And so from this AQI approach, there would be opportunities for the enhanced air quality measurements and will inform policy formulation as well. At least 75% of data should be there for this averaging and AQI calculation. And as I mentioned earlier, there should be at least one PM value. Therefore, mandatory PM data or particulate matter data is mandatory. And so because the particulate matter is the most prevalent pollutant in many areas, so so the without the PM data or the particulate matter data, the AQI or air quality index should not be published, because it will gives a misleading information. If there's no any PM data, we can publish the sub AQI values, but with mentioning of that there is no data for PM. And so because that without PM data, only the sub indices may incorrectly interpret that it has a good air quality. So but in the actual case, the actual PM level might be still high and hazardous. Right. So when we are doing the forecasting and the data presentation, we have to clearly distinguish between the measured and the forecasted AQI data, and this transparency ensures the accurate public understanding and the trust as well. So the key conclusion or the key takeaways from this video would be this air quality index of Sri Lanka bridges the gap between the technical data and the public understanding, and this is a step forward for environmental sustainability in Sri Lanka. And so we encourage you all to use this AQI data in an informed manner for your informed decision and healthier living. So thank you very much. And so with that, I would like to conclude today's video. So please do subscribe for our channel, and if you have any comments, please comment us, and it will be a really good help for us to improve from our side. And so thank you very much for joining with us, and see you on the next video.